All right, Dr. Christopher, if you're ready, we can start now.
Great, thank you.
Okay, so good morning and good evening to everyone present here. My name is Janabi Roy. I am from Christ University and I'm currently studying BSc Psychology Honors, and I will be moderating this session. Today's webinar is powered by Prescribe, which is a health tech startup backed by IIT Madras and IIM Calcutta. Prescribe aims to help doctors, clinics, and hospitals by leveraging patient-friendly platforms such as WhatsApp. The company aids in digitization of clinical practices by providing customizable modules for OPD management, pharmacy, online consultation, and even in-person consultation. It provides IT solutions which increase brand awareness and revenue generation. Prescribe is also collaborating with public health initiatives like DFY to support doctors with digital technologies in national TB eradication programs and striving to bring a positive change in the healthcare industry. I would now like to introduce our guest speaker for the day, Dr. Christopher Willard, who is a psychologist and educational consultant based in Boston, specializing in mindfulness. He has not only presented at TEDx conferences, but his thoughts have even appeared in the New York Times, the Washington Post, mindful.org, and elsewhere. He is the author of Child's Mind, Growing Up Mindful, Raising Resilience, and 8 other books for parents, professionals, and children. He is also currently a faculty member at the Harvard Medical School. But there is more to him than just that. He is a fun-loving father who enjoys traveling, hiking, cooking, reading, and of course, writing. We welcome you, Dr. Christopher. I request you to add on to this if you wish and guide us through this journey towards spreading awareness.
Thank you so much, Janabi, and I apologize if I didn't say your name correctly, but thank you for that wonderful introduction. I know I'm certainly thrilled to be here, and I just want to share a little bit about some tips on mental health awareness, particularly around the most common mental health struggles that people are having during the course of this pandemic. I do want to start by saying that I do hope everyone is safe. From what I hear, the pandemic is quite bad everywhere in the world, but I actually heard recently it's getting better in India. I'm not sure if that's actually true or not. I know that it's getting worse in the US. I also just want to say how much I love India and Indian people and visiting India. I've been to India 3 times, twice as a tourist and once for work. And it's just, it's such a great, it's just such a great place. And I keep doing more and more work with folks in India, different workshops over there, different courses, conferences, and actually having a conversation tomorrow with someone about developing an app for folks in India, young people struggling with anxiety. So it's fun to be here meeting with all of you. So I thought I would begin by just putting it out there that the reality is right now during this pandemic, this has made so many people's mental health just so much worse, right? The main things that I'm seeing as a clinician and the main things that I'm reading about also, especially among younger folks, are depression and anxiety. So these are the 2 that I want to talk about, how to identify these, and also how to support friends or loved ones that are struggling with these. The depression, one of the things I've been aware of recently is that when if I asked you to think about what is someone who is depressed, like what comes to mind when you think about them, if you imagine someone who's depressed. And at least where I am in the US, in North America, and Europe, the answer that I often get is someone who is staying at home, who is not really sleeping well or is sleeping too much, who doesn't have a very regular schedule, who is either eating too much or not eating enough, who has no interest or no motivation in doing things. And one of the things that's happened with this pandemic, of course, is that we are all basically being told to do that. Stay in place, don't leave your house. We are all feeling very isolated. Our schedule is very disrupted so that we are eating at strange times and we are sleeping at strange times. So one of the things that's happening is that we are being kind of pushed into depression by circumstance. And so I just want to make that clear that some of this is just what's happening to us, but there are things that we want to look out for. Now, depression, a few years ago, I was actually just on a phone call with someone talking about this project that I had done. And if you could enable my screen share, then I can just share a few things as well. But one of the things that I noticed when I was researching depression was that if you pick up the DSM, which for those of you that are students in psychology, right, might know that that's the big book of all the disorders that we often have, right? So if you look at what's the symptoms of depression, I thought they would all be symptoms in our minds, in our heads. What surprised me was that most of the symptoms of depression are actually physical symptoms. And this is particularly true in India and Asia and in Africa and South America, and less true in Western Europe and less true in North America. So these are particularly important to be thinking about. So the number one of these symptoms, and what I want to say about all of these symptoms is that these all have to exist for more than 2 weeks. If you're feeling this way for a couple days, it doesn't feel good necessarily, but it's really only after a few weeks that we'd want to give someone a diagnosis. But we can maybe see these as early warning signs if they're happening for a few days. Aches and pains, cramps, digestive problems that don't seem to respond to the usual treatment. So maybe you may have noticed, or you're noticing in people around you, more physical discomforts, mysterious medical problems, stomach aches, headaches, things like that. Oh, looks like I can share my screen. All right, fantastic. Have you noticed, right, feeling exhausted or having much less energy? This is something that you might see in yourself. This is something that you might see also in friends or people that you care about, right? Do things seem like they take a lot more energy than they used to study, to exercise, to get out, to shop, to cook, these basic things? Do they take a lot more energy? Or have you been feeling more tired and kind of sluggish, even if you've been getting enough rest? Right? You know, so these are the things to look out for as well. Overeating or undereating, right? Some of us, when we're stressed and depressed, we eat a lot more. Some of us, our stomach can't quite handle much, so we eat a lot less. And then this leads to things like gaining weight, maybe 5%, losing weight, maybe 5%. So just noticing, right, the folks around you, are they gaining or losing weight in a way that's unusual for their usual body type? Have you found yourself or noticing people eating a lot mindlessly to cope, or losing their appetite altogether? Oh, I'm too stressed, I can't eat. Right? And of course, you know, I love Indian food, so I know the food there is so good. So I would be eating everything in sight. But right, what else do we notice? Insomnia, disrupted sleeping, or too much sleeping. So what does this mean? Trouble falling asleep, trouble staying asleep. A lot of people I've been working with are saying they fall asleep, but then they wake up from 2 a.m. to 4 a.m. and can't fall back asleep. Or other people are sleeping too much, sleeping in, sleeping late, taking more naps than usual, that kind of thing. So are you over or under sleeping? And not just because you've got homework or you're staying up late or you're playing video games, right? Are you staying up, because you can't sleep, right? Having more trouble falling or staying asleep. Psychomotor changes, which is kind of a fancy sounding term, and that basically means, are you feeling more agitated and fidgety lately? Kind of your, foot bouncing up and down, right? Are you noticing yourself moving more slowly? Or have other people noticed this? Are you noticing this in people around you? This is something to also watch out for. Speaking more slowly, moving more slowly. This is something that we see in folks who are struggling with depression as well. So those are some of the physical things that we can see. So this is helpful when we're looking at our friends or looking at ourselves, almost imagining that we're watching a movie, right? You can even sometimes, clinicians can diagnose people. Like I see people walk into my office, the way that they walk, the way they move their body and hold themselves, I can tell this person's depressed even before I start talking to them. Psychological symptoms up here, not just sadness, but a lot of other kinds of things. Feeling guilty if you don't need to feel guilty, feeling like you're a bad person. Are you feeling unnecessarily guilty about things that aren't a big deal? Your self-esteem going down. Are you feeling hopeless and pessimistic? Well, a lot of us are feeling more pessimistic, so that's hard, right? But is life on a daily basis feeling really pointless? Are you struggling to see the positive? Does everything feel negative? Does your attitude feel worse? Do you feel like what's the point of anything? Are you hearing that from your friends or seeing that from them online? And then sad, empty, depressed, or anxious feelings, right? Feeling actually sad. And people describe depression more as feeling empty, hollow, or numb. Often they describe sadness. Crying more often, sometimes, not sure why. And then something we, of course, we want to worry about, thoughts about death, preoccupations with death, thoughts about suicide or attempting suicide. And one thing people worry about is if I ask someone, are you feeling suicidal? Will that give them the idea? And the answer is no. It's okay to ask people that question. You can also ask that question by saying to people, do you still think about the future? What do you want to do in 5 years? If they're not giving you an answer to that, you might want to worry a little bit. So have people been thinking about death or suicide more often? And then other things that we can observe in terms of someone's behavior and socializing, loss of interest in their usual activities, your favorite people, not wanting to see them, your favorite activities, getting exercise, playing video games, your favorite TV shows or reading. Do these not interest you as much? Right? Your other favorite hobbies, that's another warning sign. And then, this for a few weeks on end, not just like today I'm feeling a little bit bored, right? Irritability and restlessness. Do things annoy you more than usual? Are you getting bored more quickly? These are some of the things that you want to be watching out for in yourself and potentially your friends. And I often frame mental struggles and mental health as a combination. I mentioned this in that talk I did a couple weeks ago, right? Bio, psycho, and social. Biological, right? Thinking about the physical. Psychological, what's happening in your mind with your emotions and your mood and your attitude. And lastly, someone's behavior and their social lives. These either create mental health or they create mental illness and mental challenges. So that's depression. And then I want to turn toward anxiety, which is another thing a lot of folks are experiencing. Although I also want to say a lot of people I work with are younger people are actually experiencing, I'd say, less anxiety, more depression, more grief. But to be just aware of anxiety, there's a famous American comedian actually who visited India 100 years ago, I think went to Mumbai, and he says, I've experienced many terrible things in my lifetime, and only a few of those actually ever happened. Is what Mark Twain said. So anxiety is having these horror stories we tell ourselves about the future. And like depression, anxiety is somewhat physical and somewhat mental. And so we can look at both of these symptoms, and the physical symptoms are, again, more likely to manifest in people in your part of the world than in my part of the world, right? There's actually cultural ways that mental health manifests. So I want to just, lead off with what are these kind of biological or physical symptoms. One that's surprising to people is being tired. Getting easily fatigued is a symptom of anxiety. Are you worn out easily? Less energy for school and social life and other activities that you care about? This is because anxiety uses up a lot of our energy and really tires us out. Right? Another thing that's quite common, muscle tension, aches and pains, particularly in places like our neck, our jaw. I clench my jaw when I'm anxious and stressed, our lower back. Sometimes people developing gastrointestinal issues, stomach aches, diarrhea, things like that can be a part of anxiety, as well as feeling like your heart is pounding or your heart is racing, almost feeling like your heart is in your throat or you can hear your heartbeat very quickly. Tightness in your chest, right? Sometimes heat flashes as well can be a sign of a panic attack coming on. And then, of course, sleep disturbance. It is not easy to sleep when you are anxious. Rather than sleeping too much, which is again one of those symptoms of depression, anxiety usually is sleeping not enough. A lot of difficulty falling asleep, waking up, in the middle of the night, having trouble getting back to sleep. And what a lot of people say is just waking up earlier, feeling anxious. If you usually wake up at 7, waking up more like at 5:30 or 6 and can't quite get back to sleep, or having a restless and unsatisfying sleep, even if you're in bed from 10 p.m. to 7 a.m. or 8 a.m., still feeling really tired. So that's another one to watch out for, is sleep disturbances, particularly not sleeping or not sleeping enough and not feeling rested. Anxiety, also the psychological kind of mental parts of this, just feeling kind of restlessness and jittery, right? A little bit of shaking in your body and feeling that mentally as well. A lot of difficulty concentrating, mind going blank, right? Trying to study or, have a conversation with somebody and you just can't remember what you were saying, right? Are you, feeling that more in social situations or with schoolwork, things like that? Also, irritability, having a lot less patience with people, snapping at people, being kind of rude, those kinds of things also. And then in terms of behavior and socially, right, then these affect that as well. So avoiding situations that make us anxious, right? That's one that's likely. Avoiding people that make us anxious, right? So these are some of the behavior changes that we might see in someone, and the social changes, right? Like someone just being kind of unpleasant to be around, or they're outwardly expressing a lot of worry that's maybe not so reasonable to be worried about. So anxiety in particular is also very future oriented, worried about the future, what's going to happen next, worried about the future, this bad thing's going to happen in an hour or in a year or who knows what. Right? Depression often being kind of ruminating a little bit more on the past and things like that. Although depression's also, people talk about a cognitive triad with depression, which is basically looking, the world is terrible, the future is terrible, and I'm terrible. Feeling hopeless about those three things, that's another sign of depression. And what we want to do if we see people struggling with this, in any of these, is really just validating that this might be depression and they might want to look into this a little bit further. I don't always recommend getting on Google and looking up if you have these symptoms, because you will convince yourself that you're depressed or anxious, or you'll become convinced immediately that your friends are depressed or anxious. It can give you a little bit of information, but you can't really fully diagnose someone. So encouraging them to talk to an expert or consulting with an expert yourself, that can be helpful. And then really trying to validate people's feelings, right? It sounds like you're feeling really anxious. That must be really awful. I wonder if this is depression. Depression isn't just sadness. It's feeling a lack of motivation. It's feeling tired all the time. There are many other symptoms of depression besides just sadness. Likewise, anxiety. Anxiety is not just worrying. It's also feeling like, for some people, their heart is pounding, or feeling like they're having trouble sleeping. So reminding people that there's actually a range of symptoms. People think depression, they think just sad and crying. Well, actually, depression is very different in different people, in different cultures, even in different genders. Depression in men is more likely to be kind of irritability, and in women, somewhat more likely to be sadness. Anxiety also, right, manifests differently in different cultures, in different genders. And so reminding people that there's really a range of symptoms. And the other thing that people really often want to hear to be able to support someone struggling with these is that people get better. Anxiety is the most common mental health issue people struggle with. A third of people will struggle with it in their lifetime, so it's quite normal. The vast, vast majority of those people get much better with just a little bit of cognitive behavioral therapy, a little bit of conversation, learning a few skills like breathing, mindfulness, that kind of thing can make a huge difference very, very quickly for someone with anxiety or with depression. So there's a lot of really simple ways that we can treat these, and that can be really empowering and helpful for people, because often people feel shamed or stigmatized because they feel like they're helpless, that they won't be able to get any better. So when we talk to people, telling them that help is available, and it's very easy, in fact, to get the help that you need, and that both of these conditions are very treatable with and without medication, that can be really helpful and hopeful for them. And sometimes sharing our own experience can be empowering as well. I don't struggle with anxiety all the time, but I've certainly in my life had a couple panic attacks right? And so it's actually quite normal that probably most people will have a panic attack at some point in their life. And it doesn't mean that they're really, struggling or have a lifelong struggle with mental illness. So these are a few things just to consider when you're trying to support yourself or trying to support your friends. So I've got about 5 more minutes. And I would love, to see, I see we've got some questions in here. So someone is asking about feelings of loneliness. And I think this is very, very hard in the midst of the pandemic. And to remember also that being alone does not necessarily mean that we have to feel lonely, because a lot of us are lonely right now or alone. We can find ways to enjoy some of our time together, our time, by ourselves, as well as finding ways to connect with other people, online or offline. I don't know if you're in lockdown, right? We're not here in the US, although I know a lot of Europe is. I was talking to some friends in England and Ireland recently, and they're locked down. But finding ways to connect, I think, starting a text messaging thread or setting up a regular time to meet with people, with classmates, with friends, these can be really quite helpful for us. Like every Friday, we get together and we play cards online, or we have a conversation, or we celebrate a birthday, or even play video games, or maybe watch a movie together, something like that. Someone else is asking a question about how do we differentiate between depression and anxiety? Often they go together. In fact, most cases of depression actually include anxiety also. Most people who are depressed also have anxiety. The reverse is not necessarily true. What we can see with depression often is that kind of just more slowed down, more kind of lethargic energy, whereas anxiety, you often see a little bit more kind of agitation in people. But depression, you tend to see kind of a lack of interest in things. You can almost see it in people's body language. You can see it in the ways that, yeah, mostly that people tend to have less energy when they're depressed. That's kind of the more physical manifestation as well. Someone is asking about grief. If someone's father passed away or someone we care about, and that's certainly something that's happening in the course of this pandemic, is that people we love and care about, we're losing them and we're losing touch with them. And that also happens in regular life. So one of the things that is hard to do is to differentiate sometimes between depression and grief, because grief can be so shocking and so sudden sometimes, and really a form of trauma, that it can feel totally overwhelming and raise some of these same questions. Life feels pointless. I don't want to do anything. What we want to really look for is, is this happening beyond a few months? So grief, comes and goes, but usually really acute grief ends up passing after a few months. So these are kind of the challenge that one of the things that we can differentiate between grief and depression, because otherwise they do look quite similar. But grief will tend to fade away and is a normal process for people, right? You're supposed to grieve. Um, yeah, so another, I think, challenging question is that culturally there's a lot of stigma around some of these different kinds of mental health issues that people are struggling with, depression or anxiety. And so, I think often talking about more of the physical symptoms, that those can be treated, might be a way to talk to people about it. We don't always have to call it depression to everybody we talk to, but we might say, it sounds like this is a struggle, cognitive behavioral therapy or talking to a professional or taking medication can maybe help with some of your motivation challenges or some of your sleep challenges, or some of these other symptoms of low energy that you're feeling, or some of these physical symptoms of your heart pounding and your stomach aches, maybe being more anxiety oriented. So talking about it in terms of the physical can actually be quite helpful in terms of breaking through some of that cultural stigma, because that is a real challenge depending on the culture. So definitely. So I only have a half an hour today, and I apologize. So I do have to jump off and go onto another call. I want to thank you so much for being here. If you want to gather some of your questions, you can send them to Dr. Roy, and she can send those back over to me, and I can maybe answer a few more. And I have a feeling that I'll be, ongoing kind of in consultation with a lot of folks in India, and you can check out more information on my website. You can learn more about self-care on my Instagram, at Dr. Chris Willard. And I look forward to, being in touch and hopefully visiting India sometime in 2021. So thank you.
Thank you so much, Dr. Christopher. Thank you a lot for being here and showing us and sort of shedding light on everything that we've missed out on for the past few days. And we hope to see you again soon.
Thank you. Take care, everybody. Stay safe. Be well.
You as well.
Thank you.
Thank you, Doctor.